Thanks for joining us on Channel 5 News at 10. I'm Oscar Rodana.
And I'm Betty Garza. Some registered nurses who work in the intensive care unit of Valley Regional Medical Center in Brownsville say patient care is suffering because the hospital is understaffed.
Channel 5's Eddie Flores has been looking into both sides of the story. He joins us now live with more. Eddie.
Well, Oscar Letty, according to ICU nurses we spoke with, 7 of them have been suspended for being vocal about understaffing in intensive care, and 3 of those were terminated today. But they say the people who are really getting the short end of the stick are the patients in the ICU. Linda Valdez says she was suspended last Friday for refusing to be assigned the role of charge nurse, a position she says takes away from the assigned patient load she already has in the intensive care unit at Valley Regional Medical Center.
If something does happen in the unit, outside of the unit or in another unit, patient gets sick to the point where they're calling for a rapid response or a patient is coding, they call for an ICU nurse that has to respond. When we respond to those patients that need us because they're basically on the brink and they may be in their last moments, and we have to respond, we're having to leave our patients, our critically ill patients, to other nurses that are already overwhelmed.
Cleo Vasquez wasn't only suspended as an ICU nurse at Valley Regional, she was terminated today. She says for the same reason, not wanting to assume the duty of charge nurse.
As far as being a charge nurse and stepping away from the unit to respond to other issues going on in the hospital, it is, to me, a very unsafe assignment, and that's what we are advocating. Patient safety first.
These nurses say most charge nurses at other hospital ICUs don't have assigned patients and are free to respond to emergencies without jeopardizing care for other patients. But these nurses from Valley Regional also say many times they don't have aid workers, technicians, or sometimes even secretaries in the ICU.
I declined my role as charge so I can be with my patients, so I give myself fully to my patients that day. Not for any of this to happen. This is the furthest thing that I wanted to happen.
These nurses say they want other ICU RNs to speak up as well.
The nurses in my hospital and across the nation will find the courage to stand up and say this is not safe.
We contacted Valley Regional Medical Center about this matter, and they gave us this statement, quote, "We are not going to comment on confidential employment-related matters other than to say that any actions taken by VRMC were carefully considered in advance of any such action. We have made full and comprehensive arrangements to ensure that patient care continues without interruption or compromise. Our community can rest assured that VRMC will never allow anything to come between us and the delivery of the best in care and services." End quote. Eddie Flores, Channel 5 News.